Hi, everybody.
Hi, Terry.
Hello.
Hello. Folks are still joining, so I'm just going to wait maybe another minute or two. Okay, I think we'll go ahead and get started. Welcome, everybody. I'm Terry Bryant. I'm the director of the Whatcom Homeless Service Center and chair of this group. Thanks for being here today. I'm going to start with our land acknowledgement. I would like to begin by acknowledging that we gather today on the ancestral homelands of the Coast Salish peoples who've lived in the Salish Sea Basin throughout the San Juan Islands and the North Cascades watershed from time immemorial. Please join me in expressing our deepest respect and gratitude for our Indigenous neighbors, the Lummi Nation and Nooksack tribe, for their enduring care and protection of our shared lands and waterways. A few more people joining. I'm excited about today. We are going to be talking about our elders. I'm going to share some data. I'll just start with that. So to kind of frame the reason why we want to talk about seniors. I'm going to share my screen here. Can you see this chart? Yeah, okay. So this is from 2017 to 2019, the numbers of seniors in our housing system who had active applications, who were experiencing homelessness and were seeking services. And I wouldn't call it steady, but it hasn't wavered a whole lot, except for this lovely part right here in 2019 and 2018, where Eleanor Apartments opened and a lot of folks found housing there. That was really great. But let me show you what happened in 2022. This is why I'm alarmed. The number is increasing really steadily, and it's concerning. I think we have two things happening in our community, and this is really just my best guess. I think we have our elders are becoming homeless because they're on fixed incomes and can't afford their rent, and our homeless population is aging. Both of these things are coming together. So that's why we wanted to talk about this today. We have data from the PIT report that I'm not ready to share yet, but I can tell you that looking at the trend from 2012 to 2022, it's a steady increase in seniors experiencing homelessness. That's really concerning. So I'll stop sharing because that's really all the data I wanted to share. And oh, I have more people let in, pardon. And I'll get started on introducing our speakers today. Today we have Bethany Chamberlain from Health. She's a Health and Human Services Planner at Northwest Regional Council. We have Chuck Tolstead, Property Manager at Mercy Housing. Amanda Dre, Social Services Supervisor at DSHS, working in Aging and Long-Term Support Administration. Folks refer to that sometimes as ALTSA. And Melissa Bird, who works in gerontology, acute care, and just completed her doctorate of nursing practice. So really excited to have them all here. I haven't double checked to make sure, but do I remember right, Melissa Bird, that you wanted to go first? Or did you want to go last? I don't hear you. Can't go first. Okay. Let me check and see. Bethany, do you mind starting us off and telling us about what your work with seniors?
Sure. First of all, my name's Bethany Chamberlain. I'm Health and Human Services Planner at Northwest Regional Council. And I just want to start off by saying that I am relatively new in my position, but over the past 7 months, I've been becoming more familiar with the population that we serve. And upon asking some of my colleagues that have worked for our agency for a couple decades, I received some feedback. So I'm going to share that with you today. Because NWRC is a AAA, which is an area agency on aging. And so we aren't actually an agency that houses folks, but we do help connect older adults and people with disabilities in the community with services. And a lot of times that means steps to getting into housing. So we offer case management through Title 19, which is a Medicaid service for individuals who want to live in their homes. And so that isn't necessarily the program that we see most of the homeless, older or houseless, older adults in our work. It's our care coordination program. So we have care coordinators that are actually working in the hospitals in Peace Health, St. Joe's, and also in Skagit Valley down in Skagit County. And we get referrals from individuals who actually come into that hospital to receive services. And from there, they become a part of our Health Homes Care Coordination program. And our care coordinators offer supports, and they're basically assessing their individual situation, which a lot of times housing is either they're on the verge of becoming houseless or they're already houseless. So our care coordinators assess each individual situation and help them to create a goal plan to, get to the point to where they want to be. And a lot of times that is finding permanent, stable housing. So in many cases, just to get to the point where these older adults maybe have been living, without a house or on the streets for a very long time. Many of them don't even have IDs or social security cards or mailing addresses or verifications of citizenship. So our care coordinators help them get those things in addition to medication, food, clothing, and even primary care providers so that they can get the medical attention they need. Also, our agency provides, we're the Medicaid authorized transportation lead for the 4-county region. And so through our agency, we help set up transportation for those who are on Medicaid. And a lot of times for folks that are living on the streets, we get them bus passes and try to give them a leg up to get to where they need to be. So the goal is to get, when we have folks in our care coordination program, our goal is to get them to a stable place where they are able to look for a facility placement. Oftentimes they might need a higher level supported situation. And so we are always keeping in mind who has openings for Medicaid folks. And part of that is also, if they're not already on Medicaid, helping them go through that process as well. So just an example, we had a care coordinator this afternoon who was meeting at Woods with somebody who is currently living in a tent. And so what this care coordinator is doing is basically providing information about the services that are available, just to engage him and see if they're interested in kind of being a part of our program, accepting our services, and kind of helping them get on track. And this current individual is already working with Opportunity Council and is on a list for housing. But in the meantime, our program, we can meet people where they're at and try and help them get them into a position where they have the supports they need, so that once they make those small gains, they can build momentum and hopefully get into a house situation. So that is kind of a summary of the services that we offer, where we are mostly involved with be housed.
Bethany, a lot of the folks here are working with individuals and are always connecting them with resources. So I bet a lot of folks would want to know what's the path to connect their clients with your services.
So connecting with our services is as easy as calling our it's as easy as calling our front desk because and I can't believe because I'm speaking specifically to care coordination, we also have what's called an aging and disability resource center. And so we always have folks who are ready to take calls and a lot of times just give kind of immediate information about what programs are available. And so this also is where you would go if you wanted to see if somebody was eligible for health homes. And so just calling our front office, which you would think that I would have that number off the top of my head, and I'm going to get it in just a second here. I'll put it in the chat.
Can I just say something too? It's not just the services to start with, but it's the continuing of the services that is a problem because here I am. I was brought in and I haven't received any case management in almost 3 years. And it's really hard to struggle with continuing the services when the services aren't there or there aren't any people there to continue the services.
Laura, can I ask, are you being seen by Northwest Regional Council or are you talking in general about case management?
I am with Francis Place.
Okay.
And I moved into Francis Place in 2015 and there was great staff there and now nobody works there and there's no case management. And there are a lot of people that are losing out because there isn't any case management.
Right. I can't speak to the current place that you're at, but I do want to let you know that this is an issue with older adults because many of the funding models through Medicare, they've been like, oh, okay, we want to basically go in, give our service, and then be done because they don't want to be tied to continued financial coverage. We recognize.
But that's not fair.
I know.
Because we signed up and we signed a contract and now everything's fucked and we don't get anything. And then we're just left and we might as well be homeless again. That's what I feel. I feel I might as well just be fucking homeless again. Because here I am, I'm 51. You know, I'm turning into a senior and I'm not getting the coverage. I'm not getting the services that I signed up for. And now they're saying I can't even move anywhere that I want because I'm on shelter plus care. And it's not fair. It's not fair. You guys can't just stop the services you signed us up for and expect us to keep on living and not fuck up again.
I hear you, Laura, and I appreciate you being here and sharing your experience. I think it's really important for us to hear how that is impacting you and
interrupt and everything. I know you guys have lots of plans and stuff, but this is just something that needs to be said to everybody because I asked how to get a shelter plus care. Kristen Hill told me when I can pay for myself. And that is just a fucked up thing to say.
Oh, Laura,
I just want to say
I'm gonna
I want services. I want services that I was promised, and that's all I wanted to say.
I understand that. And I appreciate what you shared. Thank you.
Yes.
And I was also just going to finish that we recognize that there is a need and that it's hard. Our case management services, once you're in a place that you're happy or you're satisfied with, we go to the home and we do assessments and we try to keep that person housed where they're at with all of their aging issues. But we also have a recovery care program that in Skagit County, we're able to follow people for as long as they need us. And
yes,
we're hoping, Laura, that model will catch on. We're trying to come to Whatcom County and show that by sticking around, this is really helpful because tough times come and the program doesn't have any rules like if you use again.
But I want to move out of the county and they won't even let me. I want to move to a different county, one where I know that I'll get services like Skagit. because my Molina doesn't actually cover lots of things up here that I actually need. So it's just, I want to move to another county, but I'm not allowed. I'm not allowed to leave Bellingham.
Laura, your comment actually makes me think of a question for Bethany. Are these services just for seniors, or can it be anyone who is disabled?
It can be anybody who's in need, especially recovery care. And we're also branching out with behavioral health or behavioral health services.
Well, I just want to let you know that I've been disabled since I was born, and still I'm being, it feels like I've been kicked to the curb again, and I'm tired of it. I'm just tired of it.
I hear you. And that's
I'm just
not
tired of
good.
being ignored. It's like I want to go sleep on City Hall lawn again and kick up some kind of big mess about people not being served what they're told they're going to be served, and
Laura,
the help that they're going to get.
are you still staying at Francis Place, or are you in a different building now?
I'm in a different building. I'm in a different building completely.
Do they have a residential service coordinator there?
They're so funny. No.
Okay. I'm wondering if the best thing to do is just to give Northwest Regional Council a call and see if you qualify for some of these supports that Bethany is discussing.
But I don't want to talk to a social worker.
Okay.
They have messed me over so many times and told me that they're going to be my social worker, and then they're not, and I can't do it anymore. I can't do this anymore. I'm at my end. I'm at my end with all of it.
Laura, can we talk offline after this meeting?
We can talk or whatever you want. I've been trying to contact people for a long time. I knock on windows. They just don't want to see me anymore. They don't want to talk to me anymore.
Well, Laura, I would like to talk to you. So is it okay if I call you? You could send me a private message in the chat, and I'll call.
Yeah, I just want to talk to anybody who want to listen to me.
Yeah.
And help me, please, because I can't do this anymore. I can't do this
anymore. Your phone number
anymore.
in a private chat to me, and then I'll give you a call.
Yeah.
Thank you. I appreciate that, and I will call you after this meeting.
Thanks. And I just want to say I seen Joe on the list. I want to say I have something for you, Joe. So call me, okay? Thanks.
Thanks,
That's all I
Laura.
have to say right now.
Are there any other questions for Bethany? No. Okay, Bethany, thanks so much for being here and sharing your information. Really appreciate it. I think we'll go to our next speaker. I had Trek on here next, but I didn't notice him logging in. So I'm gonna give him some time here. Amanda, I see you here. Thanks so much for joining. You're here to talk about ULSA.
Hi, everybody. My name is Amanda Dre. I work for a part of DSHS called the Aging and Long-Term Supports Administration. Specifically, I work for Home and Community Services. It's a lot of acronyms, kind of a mouthful. So Home and Community Services, we do eligibility determinations and set up support services for people who need assistance with personal cares or activities of daily living. So we don't have any standalone housing, but if somebody qualifies for our services, if they are in need of regular assistance with personal care, so things like that's like day-to-day tasks like dressing or bathing or medication management, that kind of thing, then they could look into our residential options, so places like adult family homes or assisted living facilities. Does anybody it's hard for me to just talk like just a few minutes about it, because it's the programs are kind of vast. And but does anybody have any specific questions that they have about home and community services or adult
I
family?
do, but I'll wait. I'll let other people ask questions.
Great.
Doug.
Yeah, absolutely. So the kind of like the core programs that we provide are called our personal care. So it's based on eligibility is based on a need for assistance with activities of daily living. There are two parts to eligibility. One part is the functional piece, and so that's the need for assistance with personal care. And the other part is financial eligibility. Our programs, all of our residential programs are Medicaid based. And so someone would either have to already be on a Medicaid program or apply for Medicaid. Medicaid application can be done over the phone with the healthcare authority. It can be done online at Washington Connections. And we also have a paper application. And I'll put the way that we determine eligibility is functional eligibility for somebody is through what's called an assessment. And so once we get an application or a referral or a phone call from somebody saying that they're interested in our services, we set up an appointment with them to do what's called an assessment. And that assessment looks at mainly what we're looking at is supports that person has gotten over the past week leading up to the assessment. And we ask all sorts of questions about what somebody does need help with, what they don't, what the help looks like. And from there, we put all of that information in, and it determines what specifically if somebody's looking for a residential setting, it determines what their daily rate would be. And then we can use that assessment as kind of like a care plan to reach out to different adult family homes and assisted living facilities and see if that person would be a good fit for those settings. Yeah.
There's a question in the chat. Do you also handle COPE services?
Yes, these are all, so COPES is traditionally what all of our services were called. COPES was like the big umbrella that everything was under. Over the years, it's gone through some changes. Now it's technically community first choice, but a lot of people just think of us still as COPES. Yes.
So I don't know if I have the correct understanding, but COPES is like a way for folks who need it to get some in-home care. Who provides the care?
So COPES can provide in-home care, since it can also be in a residential setting. In an in-home setting, the care can be provided by an agency provider, or the person receiving care can choose to kind of hire or have a friend or a family member get hired as their individual provider, and they get hired by a company called Consumer Direct of Washington, and they are contracted to, and then that individual provider provides care specifically to their friend or family member.
Here's another question from the chat.
Yeah.
Lisa, when we have a core historian, can other providers with the release of information provide reports to add to the assessment?
Absolutely. Our assessments are based on, first, we always start with the person that's requesting care. We always start by interviewing them and gathering as much information as we can. We'll also ask for their consent to speak with other people that would also be able to provide information. And so we can gather information from anyone that they feel comfortable assisting with that assessment process.
That's good to know. Thank you. Vaughn has a question about how long does the eligibility assessment need to determine what a person is eligible for? Not sure I understand that question very well. Do you mind unmuting?
It's ambient. Can you hear me okay? Is the ambient noise too? Okay. Basically, like, so from the moment that somebody calls in needing something, and then they start that eligibility assessment process, about how long, and say they're eligible, but how long on average would it take to make that determination that they are eligible?
Thanks.
Is that
Vaughn.
okay?
Yeah.
Yeah, that's a really good question. Right now, our people that do assessments are scheduling out on like sometimes 4 to 6 weeks out. It just really kind of depends on what their availability is, how many referrals we've been getting, how many requests we've been getting. The assessment appointment itself, I tell people to plan for it to take about 3 hours. And then to get services into place, again, it takes another chunk of time. We are seeing a caregiving shortage for in-home care providers with agencies. We're having a lot of trouble. It's taking a long time to staff people who need in-home care. It is a little bit faster if they have someone that is able and willing to be an individual provider. That can get it set up a little bit quicker. And then for adult family home searches, I usually tell people to plan for about 3 months, just because there's a lot that goes into that, right? Because you want it to be a good fit for that person and to make sure other needs are going to be met.
Could you talk a little bit about adult family homes and, assisted living and memory care and retirement living and what the differences are with those different modes of living?
Sure. So an adult family home, the way that I think about it is that the smaller the setting, the higher the level of support somebody is going to have available to them. So at an adult family home, there are usually around 6 people that might live at an adult family home. Sometimes there can be up to 9, but it's usually that 6. And then there are so many different kinds of adult family homes. Some of them are set up so that the person who owns that adult family home lives in the home. They provide a lot of the care. They only have that one adult family home that they run. Sometimes the adult family home owners may own a few homes and then hire staff to come into the home. Some adult, and then as far as like the bedrooms, most adult family homes, a lot of times people are sharing a bedroom with one other person, but sometimes people can have private rooms if that's what they need. An assisted living facility is going to be a much bigger setting. It's got a lot more people in it, but then the staffing ratio is much lower. Assisted living facilities are really geared towards people who are mostly independent and then just need a little bit of support. The adult assisted living facilities, people always have a private room or kind of like a studio or a little apartment, private bathroom. There's some that the bedroom or the living space is their own, but then they share a bathroom between the person who's just on the room on the other side of them, kind of like a Jack and Jill bathroom. And then memory care facilities are usually based out of assisted living facilities. And those are specifically for people who have been diagnosed with dementia or Alzheimer's and are starting to need a high more attention related to that.
Thank you. Go back to the chat. I don't want to miss anybody. Here's another one from Marisa. Does a new assessment happen if a major change happens for the client or add to the previous assessment?
Yes, that's a great question. So we do assessments. We do the initial assessment to determine eligibility. From there, they always happen on an annual basis. But if there's a significant change in the level of need that somebody has, we'll do an additional assessment at the point that the change is happening. Yeah. We even call them a significant change assessment. So
Thank you.
Yeah.
Joe has a question. Are you seeing an uptick in requests and wants to know what are the trends?
we definitely are. There was a tiniest bit of a slowdown towards the beginning of the pandemic, but it really didn't last that long. And the number of requests that we get is just on a continual steady increase.
Yeah, I'm not surprised by that. Another question in the chat. How long does an assessment stay valid or active in the event there's a major delay in placement?
That's when I can't give a specific timeline for. It's really a case-by-case basis. It depends a lot on one of the major factors that it depends on is the amount of the communication, the lines of communication are staying open between the person requesting the services and their case manager, the person trying to set the services up for them. If we lose contact with somebody and we are trying to reach out to them and we can't get a hold of them and we haven't been able to set up services either, that case is not going to stay open for as long as, say, someone who is that we are able to stay in contact with.
Understandable.
Yeah.
Okay, another chat question. May we hear about the need for mental health designation for adult family homes or assisted living?
What I know about that is that if somebody has any sort of mental health diagnosis at all, even something like depression or anxiety, for example, the adult family home that they are going to move into is required to have a mental health designation, meaning that provider has gone through training to be able to support people with mental health needs.
Thank you.
Mhm.
I have another question, and that is, can you talk about the availability of beds for clients that are Medicaid?
Mhm.
I have an ulterior motive in this question. I'll be fair. I'll come clean about it.
Okay, yeah.
Just in my personal experience,
Yeah.
usually an adult family home will have one bed that will accept Medicaid rate, and it is subsidized by everyone else in the house paying a market rate. And that's why it's so darn hard to find placement. And then I have another question for you.
Yeah.
And then I'll leave you alone, I swear. This last question is, since we're working with a lot of people experiencing homelessness, how can service providers coordinate with your team to get people assessed when they don't have a home?
That's a great question. Because that is definitely, I would say that is one of the barriers with trying to do an assessment with someone who is currently houseless is honestly just pinning them down. They change locations, maybe their phone, maybe if they had a phone when they first applied or got referred to us, and then it gets shut off or it runs out of minutes. And so the biggest help is just knowing that we have if that person has a community advocate of some kind that can help us coordinate, can help us reach that person, that makes a huge difference in our ability to get them set up with services.
That is really great to know, Amanda. Thank you. I
Yeah.
think I see a lot of people who do outreach work here today, so that's something good to know. Get a release of information for Northwest Regional Council and help keep your clients connected so that their cases stay active.
Yes.
Any other questions for Amanda?
How long does your program last? Does it end?
It lasts for as long as somebody is still eligible.
Okay.
Thanks, Laura. Any other questions? Okay, we'll go on to our next speaker, Melissa Bird. Thanks for joining us.
Can you hear me this time?
I can.
Yay. Hi, everybody. I'm Melissa Bird, one of the founders of Road to Home and also a nurse in the community, and just was on a lovely 3-year long tour of other hospitals in the Pacific Northwest. I'm very familiar with Peace Health. I was a care manager in the emergency room there, and then also a discharge planner. So I was just going to talk a little bit about what happens when folks enter the hospital system, and how, other ways to discharge besides discharging to the streets. A lot of the times that is payer-based. So if a patient has Medicare, that's straight Medicare, no Medicare Advantage plan. You can have a Medigap plan, but just straight Medicare. The rules are you have to have an inpatient status for 3 overnights in order to qualify for a skilled nursing facility or rehab placement after discharge. Now, it doesn't matter where your patient is in the hospital. They could be outpatient in an inpatient bed. They could be marked observation on the 4th floor. They try to keep patients, separate, but really it doesn't matter where your patient is in the hospital. It really matters the status of observation, inpatient or outpatient. And if your patient has like Medicaid or a Medicare Advantage plan or a commercial policy, then we need authorization, and the insurance company has to be contracted with the local facility, and they have to get authorization just like you would for any other services. So this becomes a barrier for folks that are houseless because the facilities also want them to have a discharge plan. So a lot of times what happens is folks end up doing their rehab in the hospital because there is no other alternative. And that could be a little shorter than what they would get with their insurance. And then sometimes too, some of the best rehab for like a brain injury or a stroke is called inpatient rehab, which is different than a skilled nursing facility. And those places have very strict requirements about discharge. Someone has to be with you for 24/7 for like 7 days. And so it's very difficult for folks without support to have that as a resource. And then for the rest of folks like on Medicaid, you have to have your insurance company agree for how long you can stay in these rehab facilities. And it's not just a problem here in Bellingham. I've been to Prov Everton, Skagit, and Island Hospital, and Harborview, and UW, and everywhere has patients in beds that are there for rehab purposes and no longer meeting acute care requirement to be in a hospital. There was an expose a couple years ago that one of the news stations did, and it was like over hundreds of patients that are in the hospital just waiting placement, waiting the 4 to 6 weeks for home and community services to come, and then finding that adult family home that might not even be in the community. It might be Snohomish County, King County, even farther placement. So then you're removing people from their little minimal support system that they may have had. Additionally, when folks get admitted to an adult family home, which is more common than like an assisted living, then their payment, their actual income changes. So if they're getting Social Security, then they only get a very small monthly portion. Like, I forget the actual numbers, I'm sure Amanda might know, but you get a much smaller portion of your monthly income. And that's a huge barrier for folks because then they can't go out and buy what they need, what they want to buy. It's very minimal income you get after you get placed. So that's another barrier. There are some good things happening down in King County. Harborview made a program where they have folks that don't have a place to go after discharge. Now they can stay in a respite bed type facility, and they have access to nursing staff and other things for their medical needs, and also other resources for housing. That's been a pretty new development. And then when I was at Prov Everett, at least for the winter time, they had a shelter that folks could go to after the hospital. That wasn't the Union Gospel Mission down there. It was a different facility that kind of helped them too with other resources for housing. It was only, I think, in the winter months they were looking to expand it. And then in our own town, we have now they're at the mission. But we are working on that way station, and I can't wait till that opens because that really is the hardest part, I think, for folks who leave the hospital. There's nowhere to go. How do you take care of your wounds? You're sick, you're tired. If we discharge you, just because you're medically ready doesn't mean you're actually physically ready to sleep on the street again. So that's just kind of what I have. There's also a lot of street medicine programs that are starting up to kind of help with these situations, at least the medical side of getting the medical teams out on the street to these people to help them before their situation gets any worse. Just their medical piece, though, that doesn't really help with a lot of the other resources. So that's what I know.
That's a lot. You know a lot.
Any questions on all that?
There's one in the chat, but I just want to give some context real quick for if anybody isn't following all the details of programming in Whatcom County, which is totally understandable. The Way Station is a partnership between the Health Department, Peace Health, Opportunity Council, and Unity Care Northwest. And it's going to be, it's in the Health Department's current building at 1500 North State Street. It's awaiting permits to be approved for the remodel, which is really exciting. Half of it is going to be day services with showers and laundry, and also Unity Care will have medical professionals there, behavioral health professionals there. The other side is the respite service, and that's going to be 18 beds that will take referrals directly from the hospital for folks who really need to recover, and they really can't do that when they're sleeping outside. So that's yeah, that's exciting for us. That's the Way Station. Bart has a question in the chat. He wants to know, did that respite in King 24-hour nursing staff, did they deal with incontinence?
I don't know off the top of my head, but it was called the Harborview Respite Program at Jefferson Terrace, and it's kind of like an assisted living. So I would think that they might. But if you wanted to look into it, they have a website through UW Medicine that has more details.
So it's affiliated with the hospital. That would make sense. If they have more care. Yeah. Any other questions for Melissa?
Yeah, and I wish it was as simple as when your person needs help and you bring them to the hospital that will admit them and take care of them and find them housing, but resources are just so limited on the healthcare side. That it just doesn't happen like that. Sometimes people end up hanging out in the ER, as you all well know, waiting for services that don't meet requirements for admission. And then it's just a nurse care manager and some social workers in the ER trying to help folks get the care that they need that might not be available. Hey, Joe.
Joe.
Hey, Melissa. Hey, I was just curious. Is there also when you're describing people sitting in the hospital who need rehab services and they can't get it because they got Medicaid or they got this or that? Do you think that's also increasing, or do you think that's kind of staying level? And what do you attribute this to? The age? I mean, I'm curious what if it is increasing? I assume it is. What might it be attributed to? Insurance, lack of places to send them? What? Just curious.
Yes. I think it's a mix of everything. Also, as a nurse, people are sicker. We have more chronic diseases. We have more exacerbations of chronic diseases. When our houseless population is older, that means our houseless population has more chronic illnesses. And how do you manage that? How do you manage that when you don't, know where you're going to sleep or anything like that? Your insulin's probably not your first priority. And so we're aware of that, but I do think that's just a combination of everything. And then, insurances are getting not stingy, but a little bit harder to get things approved. And then facilities, they don't have bed space. And so therefore they're a little bit more picky. Some facilities don't even allow you to come if they see smoking history in your chart. They will not allow you to go there. And that's housed or unhoused. They make patients sign contracts that they can't even go outside and have a cigarette anymore.
Wow.
Which would be another barrier for a lot of people.
Yeah, definitely. Definitely. I was going to ask you a question and then you said that and it kind of blew my mind and my question went away. Wow. Here's the question. I met that skilled nursing often does not want to accept someone who does not have housing because they cannot discharge them anywhere. Is that true?
Yep. You really do kind of have to, like, that's what the hospital social workers and nurse case managers do, is they really try to work with the patients and the facility to say, okay, this isn't the best discharge plan, but we've called their case manager, they're going to stop by, you should coordinate discharge with them. I think some places can be more relaxed than others. I think we can think of places and their locations and where they might not be as accepting of different situations, but others will work a little bit better with. But yes, no, not having a place to discharge to is an absolute barrier for placement.
Thanks, Melissa. Any more questions for Melissa? No. Okay. I just want to ask if Chuck is here and maybe signed in as somebody else, just in case. Nope. Okay. Well, thank you so much, Melissa. Really appreciate all of our speakers making the time to come here and educate us about really how hard it is to get services for seniors, especially when they don't have housing. That's something that our community will be grappling with, I'm sure, as boomers age. Doug, did you have something to say?
Well,
I can't
I'm sorry.
disagree.
I'm sorry. I just wanted to say, yeah, exactly. You sign up for these services, and then there isn't anybody else anymore. There isn't anybody anymore. So then you're just kind of waiting for things to happen, and it is, the services are lacking, and it makes me sad. But how many times do you have to go and bang on windows and people's doors and stuff like that and call them and harass them before you get an answer? I've been the squeaky wheel. Yeah, it is really sad. And I'm not just talking for myself too either at this, because I advocate for the homeless as well, because I've been out there on the street. So yeah, I just feel for everybody out there that is struggling like I am. So okay.
And I think it just really speaks to our society in general. I think most of us are all feeling this, that there isn't enough funding for these services. And then when there is funding for services, then it gets cut, it gets moved. Finding people to provide the services for the amount that is paid, there's a lot of barriers, and it comes from way larger than the people in this meeting. And so I think as a society, we have to keep pushing for services for people who need them. Unhoused, disabled, abled, it's just we don't have a safety net in this country. And in working in the medical field, I see it so much. It's disheartening sometimes.
It's just really sad that people just don't care anymore, care about each other. And that's what makes our society the way it is. And that's what makes the homeless population and everything that's going so bad. That's what makes it like it is, because people just don't give a shit about anybody anymore.
Yeah, Laura, I know you're a strong advocate. And am I remembering right that you did the very first camp out on City Hall?
Yes, I did.
I remember
3 years in
that.
a row, all by myself. The second year I had help, but the first and the third year I did it all by myself with nobody.
You're a strong advocate, and I'm glad you're here advocating for yourself. I didn't get your phone number, Laura, but I'm wondering, can I put my number in the chat and you can just call me?
Well, yeah. I'm sorry. I don't know how to touch all these buttons yet. So I'm.
Can you see the chat?
Yeah, I can. I can see your eyes. You're like one of those people that, like, if you had your fingers up like this,
Okay.
up a little bit, you could be like a little peering out.
Okay, I put my phone number in the chat, so give me a call. I want to talk to you more for sure.
Okay. I don't even know how to get to the chat right now, so. But yeah, I will. Thank you. Thank you.
Any other questions for Melissa? And I mean, what she says about advocacy is still, the cat's about to jump on the computer. I'm sorry. Everything she says about advocacy is so important. That's how I met Melissa. She came in and was advocating for one of her clients. So even though sometimes the answer is no, in fact, you're probably going to get a lot more noses than yeses. Keep doing it. Keep doing it. That's my message. Back to the agenda. If there's no more questions, see anything in chat. The next item on our agenda is an update from the city of Bellingham. Sanya had emailed me one, but I see Kate Bartholomew here, I think. Did I? Yes. I don't know if you want to do that, or do you want me to go ahead and read Sanya's?
Yes, sorry. I am sort of sitting in her place, but go ahead and read her update, and then I'll add on if there's anything else or if you have questions.
Great. Okay, here it is. This is about the city's consolidated plan. I know you worked really hard on that, Kate. The city's draft 5-year plan for housing and services funding is now available for public comment. Thank you to the many of you who have already provided early feedback to help shape this consolidated plan and the assessment of fair housing process. The full, oh, sorry, she did it. Sorry about that. My cat totally jumped on the computer. Okay. The draft plan is on the internet where you can read it. And there's a couple of links that I'll put in the chat for you to read the plan and provide your feedback. But the goals for 2023 to 2027 are: 1, reduce housing cost burden for low and moderate income households. 2, provide vulnerable households with services to remain stably housed. That's exactly what Laura's talking about here. Help vulnerable households meet their basic needs, food, hygiene, etc. Increase safety for vulnerable groups, especially those who are unsheltered. Prevent housing discrimination and increase protections for low-income renters. And I forgot to count those off, but there were 5. The goals are broad. The city would like your feedback on how to prioritize between the various possible strategies under each goal you have a few minutes, please help strengthen our plan by responding to our consolidated plan partner survey. If you have specific feedback that's not captured in the survey and would like to send in your comments directly in the form of an email, that is also welcome by the end of the day, March 31st.
Yeah,
Whoa.
I know. I actually think I sent that blurb you just read to Connor and was hoping it could go out to the group in advance because I know the timing of this.
He did.
Oh, okay, super.
did,
Okay,
yeah.
good. So hopefully you all saw that. So technically our comment period is closed, but if this is news to you and you haven't had a chance to look it over, you can still send me an email. I'm kind of in various stages of finalizing it right now. So obviously I can't like put written comment in forever, but I'm getting ready to take the draft plan to our Community Development Advisory Board next week. And then I think it's going to be the April 27th or something council meeting. It'll be presented to City Council. So anyway, I guess I could just probably to this group. I think you're all pretty in touch with what's going on in the community. But we did sort of separate a change from the past is that we separated out the cost burden issue sort of from the continued support and services issue is two separate goals. And then also the emphasis on renter protections and enforcement of fair housing. We're hearing a lot from renters around the community about housing that's not safe or is just not in good repair. So that's an issue in addition to our low vacancy rate and high rental costs. So those are kind of some things that have garnered some attention lately. And there's just a lot of data and a lot of information in the plan about what's going on in our community in general. And again, if you haven't ever heard of the consolidated plan, I think it's just good to know it's there. It's a 5-year plan. And if you're ever wondering what the city and our partners are doing about this or that, you can always, do a word search in the plan. It's online, and then kind of get a sense of what might be going on in the community. So yeah, that's that. And feel free to email or message me. I think my email or contact information is all over the consolidated plan web resources, but I'll put a couple links in the chat as well. Thanks.
Thanks, Kate. Anybody have questions? I'm going to take a stab at describing what the plan is for. Stop me where I'm wrong. And I'm going to do this because I didn't understand the plan until I served on the advisory board to the plan a few years back. So the plan is it's a requirement by the feds, right? You have to do it. It's a HUD requirement. And it really is how you are going to spend the funding that you collect in, how you're prioritizing funding. So that could be federal dollars. It could be I think a lot of it is our local housing levy is providing the most of it. And if I remember right, over time, the federal portion of funding has steadily decreased and our local contribution has increased because we have twice voted yes for the housing levy. Do I have that kind of right?
You do, yeah. So because we have to do a plan every 5 years anyhow, we kind of use that as a reason to roll all of our funding kind of together. It's all for low income services and mostly housing. So we have our levy, which is about 7 million. The majority of the funding is like 4 million a year out of a total, I think, of 9 million. Plus we have now about 3 million in local affordable housing sales tax. It's city and county. And then we have another, 1 or 2 billion from HUD federal sources. So the federal sources of funding are smaller and smaller in comparison to other local funding sources, but we just kind of wrap it all into one plan because all of those dollars are for our lowest income and vulnerable residents.
Perfect. Thanks, Kate. Okay, I see Barbara. Do you want to do the county update?
I can do that, sure. Yeah, thank you everyone for the presentations. I just wanted to mention that that was, for those of us that work in an office and are based in, working with funding and the more administrative aspects of homeless housing, it's just, it's so, I don't know, it's really sad. That's all I have to say. And I just want to acknowledge everyone's work out there. I can't imagine working under those circumstances. And I've worked in some pretty tough situations as a case manager. So just kudos to all of you for, your commitment to that work. And
Thanks for being a case manager.
you're welcome. It was some of the most difficult work I've done and some of the most rewarding. Yes. So with that, I'll move on to the drier topic, but very important topic of funding. So Whatcom County projects funded by HUD COC funding were once again full for a total of 2.6 and some million dollars. So that's a substantial amount of funding that is going to continue coming into Whatcom County. And these are grants that are awarded to, 4 of the grants are to Opportunity Council and the other grant to the Housing Authority. So thank you to them for once again submitting their applications. It's a competitive process to get awarded that funding. So time and time again, I see them get funding awarded from year to year. So it's a lot of money and it serves a lot of people. Some of it includes shelter plus care rental assistance. The supportive housing program Dorothy Place is also a beneficiary of these funds. The community leasing program for Opportunity Council. They have a rapid rehousing program that is partially supported, and 22 North. So I just want to call out the Opportunity Council and Housing Authority for their great work year after year in getting those grants funded. And another type of federal funding is the Youth Homeless Demonstration Project. And that has also, we've received an award from that federal funding in Washington State. And in fact, as we speak today, Chris is at a meeting for service providers and young people with lived experience who are gathering to provide input into how that funding should be spent. So this includes a total of over $5 million for new programs. So this is not just renewals, it's all new funding. And it's over a 2-year period of time. So that $5.2 million would be split in half for each year. It is for the balance of state counties, and there are 11 of those counties that are not already receiving youth homelessness demonstration project funding. So it's uncertain whether or not Whatcom County will be one of the counties funded, but nevertheless, nearby counties will, if we're not. And it's my understanding that this funding can be used for youth-oriented services, housing support, youth-focused performance measurement, and also coordinated entry systems. So we'll be looking forward to hearing if Whatcom County will be benefiting from those funds. And then finally, just kind of a quick legislative update as far as funding for homeless housing. One of the concerns that we have been monitoring throughout the state is that there's been a reduction in document recording fees being submitted. And that impacts our homeless housing program funding because we have one of our main sources of funding locally is document recording fees. A portion of those fees also goes to the state and is distributed to counties through a grant, a state grant called the Consolidated Homeless Grant, otherwise known as CHG. So we're a little bit concerned about that. There is some funding that the state is going to be able to help backfill the loss in this funding for, but it's unlikely to totally cover that revenue loss. So at least it will help with the grant awards. And this is funding that provides for locally, we use it for things such as rental assistance. The grant itself funds the HEN program, Housing and Essential Needs, which is a huge program in Whatcom County, serving a lot of people who have very extensive needs. And the grant funding can also pay for operations for homeless housing programs, staff such as staffing. We're monitoring that closely and hoping that we'll be able to get adequate funding to maintain our current contracts and even maybe more to fund others. And then finally, switching gears from funding, I also wanted to mention that if anyone with lived experience of homelessness is interested in providing input through a crisis response improvement strategy committee, it's a long name, and this is through the Healthcare Authority. There's a link, and I'm going to put a link in the chat box to the website page. And if you scroll down, you'll see the meeting link for upcoming meetings, and including one on April 10th from 1 until 3 o'clock. Any questions or comments?
About that meeting on the 10th?
Yeah.
Can you say what it was about again?
Sure. The meeting on the 10th, let me see, I got to look at my notes here again. It's for how to improve crisis response for people experiencing homelessness.
And that did experience homelessness as well, and their input about it.
Yes, it's for input about that.
Well, count me in. I've been homeless, and yeah.
Thank you. I'm going to put this link in the chat box, and that will give you a way to connect and let them know that you're interested.
Okay, thanks.
You're welcome. Thank you for your interest. That would be great if we had someone from Whatcom County participating.
Absolutely.
You know, Laura, I can think of a couple of other opportunities that might be good for similar groups to inform on our services. I'm pretty sure there's one at the state level working on input on our coordinated entry system from people with lived experience. So when we chat, maybe we can explore that a little bit.
Yeah, okay, yeah, absolutely.
Thanks, Laura.
Absolutely.
Okay, well, getting to the end. Next item on our agenda is the Whatcom Homeless Service Center update. That's me. It's not perfect, I'll be the first to admit, but I have put the last 3 years of meeting recordings on the internet at last. And there's the link. Working on getting a link from our website. Our website is in the process of being completely revamped, so just baby steps. But if you need to go back and refer to a meeting, you can go to our YouTube channel and go to the year you want to see, and all the topics are listed there. So we'll go back and reference that. I want to remind folks that we have walk-in hours at the Homeless Service Center from 1 to 4. And those are for folks who need help with housing search. The folks that this works best for are people who have income and who could pay rent, right? But maybe just have barriers that they need help overcoming. And if they're not connected with the case manager already, and if they're not eligible for other services. So for example, to make an application in our homeless housing system, you have to be income eligible. So even if you don't have a place to stay and you have income, we can't serve you. Well, this program can. So I encourage you to come. It's a drop-in basis. So you just go to Opportunity Council 1111 Cornwall, go to the front desk, let them know you're here to speak to the housing navigator, and then she'll come down and get you or your clients. And Vaughn, are you talking about the YouTube? Are you talking about crisis response? The crisis response link isn't working. Sorry, got derailed there. Another thing I almost feel like I need to whisper this update. We're fully staffed. It's so fragile. We have all our positions filled. And I'm just so excited about that. And I'm crossing fingers that we can.
I'm gonna go knock on your windows.
Then the last update I have is about HOT, and the city Department of Public Works has this really, I think, really cool partnership with Honey Bucket, and it's to service RVs. So I think it is once every 3 weeks, Marisa. But Honey Bucket pairs with HOT. They go out and connect with folks who need to have their sewage systems emptied. And the thing that's really cool is that the people doing it are so understanding and kind, and the people receiving the service are really grateful, and they really had no other option. And they'll help anybody if you're using a bucket, whatever. They don't care. That they will help you get those systems pumped out if they're in an RV. So spread the word. If you know someone living in an RV, it would be good to make sure that they're connected with HOT so they can benefit from this new program.
There's millions of people down there on the bottom of Cornwall.
Oh, they were there yesterday morning, Tuesday morning. But yeah, definitely they were there recently.
Most excellent.
Any questions for me? I forgot to invite everybody to Bart. We are the poop patrol. I forgot to invite everybody to put your email in the chat if you need to get added to, or to introduce yourself, or to get added to our mailing list so that you can get agendas and advance notice of meetings. But we also circulate opportunities for advocacy. So you'll see some stuff coming from the Low Income Housing Alliance, for example, opportunities to advocate with our legislators. Laura, I can help you get the links when we chat later on.
Okay.
So, yeah, I'll work on that for you. That's not a problem.
And I won't lose them. I won't lose all of the links and stuff.
No, you won't. In fact, I'm
computer illiterate.
I saved the chat, and I also figured out how to save a transcript of the meeting. So I don't have those two things posted yet, but I have.
You do have my email address, and I did get the stuff. So.
Oh, good.
Some of it.
Okay. I'll make sure you get those links then.
Okay, but I still don't know how to do it though. But okay, yeah, we'll talk.
I'll
later.
help. Yeah. So last thing on our agenda is public comment or request for additional topics. It's usually 5 minutes, but we have 15 left in our meeting. So if anyone wants to speak, feel free. Well, maybe we're going to end a little early. Thanks everybody for being here. Oh, did someone have a comment?
Oh, sorry about that. I like I said, I don't know what I'm doing, so I got offline. And I like touched a button or something, and it just disappeared. So I'm sorry.
No worries, Laura. No worries at all. Okay, Marisa says thanks to the presenters. Yes, thank you everybody who spoke. Really appreciate your information and helping us understand what is a very complicated system to get the resources that we need elders to get.
Yeah, thanks. for listening to what I have to say too. I appreciate it.
Absolutely, Laura. Our next meeting is June 1st. Same place, same time. Thanks so much for
I'll be
everybody.
there.
We'll see you then.
Bye-bye.
Thank you all.
Thanks for listening.